Hello everybody, I hope we've had a great week so far. So in today's video, I'll be talking about a very interesting profession in the medical field. It's a profession called the Medical Licentiate program. So over the past years, this is a program that has been evolving and it's been in existence for over 20 years now. But who is a medical licentiate? So licentiate, the last part of this word means permission or freedom. Okay, so it's a Latin word that means permission or freedom. So medical licentiate, simply these are medical personnel that have the license to practice medicine. Now, who really is a medical licentiate? So a medical licentiate is a non-physician clinician, a holder of a bachelor's of science in clinical sciences, okay, trained to fill in the critical gaps in rural healthcare, right? So when you follow statistics, you find that the World Health Organization discovered to say in Zambia there is this physician to population ratio that has not been balancing over the past years. Okay, the number of doctors that are saving the patients in the different communities is not balancing. One doctor is saving so many patients than usual. So the medical licentiate program comes in to cover up that gap, to save that population that is not reached by at least a qualified surgeon, that population that is unable to get access to the key surgical procedures that can be accessed, let's say, from a general or central hospital. So they're more like cost-free surgeons, medical licentiates, I would put it that way. So now, when did this program start? How and where did it enter in Zambia? So in the year 2002, this medical licentiate program was introduced in Zambia. And at the time, Chainama Health College of Health Sciences is the only school that was training medical licentiates in Zambia. So it's introduced in Zambia, and medical licentiates trained then, they would get an advanced diploma. So you would operate with an advanced diploma and you'd be called a medical licentiate, no longer a clinical officer. So in 2009, Solidamed, a health organization, came on board, okay, to strengthen this program, to support it, and to find many other places where these medical licentiates can be trained. Now in 2011, something great happened. This program started evolving even more. Okay, clinical officers were now accorded an opportunity to do certain degree specialized programs in other fields of medicine. Okay, in 2014, officially this program's curriculum is upgraded. Okay, people are now getting a degree in clinical sciences, okay, to become a medical licentiate. So the curriculum, some of the things are revised, and now it's no longer an advanced diploma, it's now a bachelor's degree in clinical sciences. Now that's 2013. Okay, so in 2014, okay, this program receives accreditation from the University of Zambia. It's now recognized. This program now receives a mark and a stamp of approval, okay, because it meets certain criteria, it meets certain conditions, right? So from 2018 to 2022 now, this program is well recognized, and we see the Ministry of Health coming on board to actually even, advocate for this program, advocate for the people that are working in this system, that they can be recognized more and that many people can come on board and pursue it, more especially clinical officers that have been in service. Now, talking about that, so the admissions criteria for this program, for you to enroll in this program, it's either you've worked as a clinical officer, you've got a diploma, you've got at least 2 years experience, or you can go as a direct entrant. Though nowadays most universities are not offering direct entrance platforms, but back in the days you would have a diploma with at least 2 years of experience as a clinical officer, or you'd come as a direct entrant where you go through A levels or natural sciences, you do your chemistry, your biology, your physics, and chemistry. So now, what do medical licentiates do? So like I mentioned, this program was introduced to fill in the critical gaps of human resource in hospitals, okay, in a place where people are unable to access surgical procedures, okay, things like cesarean sections, appendectomies, hysterectomies. These are life-saving procedures that if someone like a medical practitioner, a medical licentiate is equipped with, are able to save lives even in rural areas as they operate. So there are places where a qualified surgeon is unable to reach. So now this medical licentiate program comes in to fill in those gaps, okay, to reduce on the frequency of referrals, to reduce on the number of what? Maternal deaths and neonatal deaths. That's where the medical licentiate programs comes in. And now remember I told you about that physician to population density that was discovered by the World Health Organization. So to address that, or to find a solution to that, that's how, okay, this program came into picture. See, here's a clinical officer who has been in service, and all they need are just skills, surgical skills, advanced knowledge in certain areas. So they said, well, if we can train these in a short space, we would have many of them in a specific period of time, and at least that patient physician to population ratio would be addressed and the number would come lower. So what's the career advancement for medical licentiates? Okay, what's the career pathway for this program? So medical licentiates can advance to become medical doctors, and they're exempted for just 1 year. Okay, so they're exempted the first year and for some courses. They can choose to go the research and education pathway, so they can become lecturers, they can become researchers and clinical scientists. These are also people who can go in administrative roles. So at district hospitals, they can stand as people running district hospitals. They can be in charges, okay, of hospitals. These are people that can manage administrative roles in hospitals. So they're not just limited to them operating in surgeries, in the field of obstetrics and gynecology, pediatrics, but they can serve in many more other areas that can help better their skills. Talking about specialties, so these are health personnel that can specialize in the field of anesthesia. They can specialize in ophthalmology. They can specialize in surgical care. So those are some of the few options that are there for them. Even though they are limited, their career pathway is short, they can always keep themselves busy in those other areas or pursue medicine. So this is the medical licentiate program. This is the profession that I did back in university. It's an interesting one, and I want to say it depends on the passion someone has for what they are pursuing. There's no program out there that is easy, that is simple, but every program comes with its own critical and crucial demands, okay? No one is high above the other one, no one is low above the other one. But where hierarchy and protocol have to be observed, let it be observed. I wouldn't say I am at the same page as doctors, okay? And I wouldn't expect a doctor to say I'm not an important, okay, body in the medical field. So in the medical field, we are a team, okay? And as much as we work hand in hand with doctors, there's a point where I'll say this is where the doctor has to step in. And there's a point where I'll say, this is the point where a medical licentiate has to come in. This is the point where a nurse comes in. This is where a radiologist comes in. And at the end of the day, we are a team with one goal, and that is to serve the patient. So lastly, before I conclude, once you are done with the training of a medical licentiate, it's a 4 years course and 1 year internship. So altogether, 5 years, right? So that's about the medical licentiate course. I hope you've enjoyed this video, and I hope you'll be inspired to study medicine and save life, save the nation. It's goodbye for now.